Hello, I'm Dr. Deborah Elkis-Abuhoff, the director of the Creative Art Therapy Counseling Program at Hofstra University. We would like to welcome everyone from around the country and the world to the annual virtual conference. I wanted to welcome you to session 3, which is Grief, Loss, and Mourning in a Time of COVID, Complicated. And that will be presented by Vivien Abrams. So I'm going to invite Vivien Abrams to take over. Thank you.
Hello. I'm gonna stop. Hopefully I'll be able to pull all of this connection together. And I just want to put this up and hopefully. And I'd like you to focus just now and start our session with intention and just a few moments of quiet for all the people that have died during the pandemic. So I'd just like to welcome everybody, and it's not unusual for me to try and give a lot of information in a small amount of time. And I know that this is a topic that's relevant, but also challenging. So we're not just talking right now about grief, but we're talking about grief and trauma. And right now, we're in time of not only loss, but traumatic loss and traumatic grief. I'd like you to think about grief.
Fix that.
Hello, is there, okay, thank you. I'd like you to think about grief like any other wound after an injury, that the wound would become inflamed as part of the healing response. With complicated grieving, it's like an infection that develops because maybe the wound did not get good care in a timely fashion, or dirt, bacteria got into the bandage. Usually, about 10% of people develop complicated grief after a loss, of the 20 or 30% that are at risk for it. I believe that the next pandemic will be the flood of complicated grief and traumatic bereavement secondary to COVID. Keep in mind that trauma potentiates loss and interferes with grieving and mourning. Not being present with a dying loved one certainly is an example that we're all very familiar with during this time of COVID. So just to go over briefly, I'd like to start with a few general ideas about what grief is, the symptoms that are normal in quotes, because normal is a cycle on the washing machine. There's no real normal. Things change by culture, by gender, on how people experience grief and how they grieve and how they mourn. And all of these things are turned upside down and backwards now that we're going through COVID. A few signs and symptoms of grief in general. And again, nothing is cookie cutter when it comes to grief and loss and how people experience it. But usually people have feelings of sadness, loneliness, even anger is certainly not uncommon. People have difficulty focusing and concentrating, disturbance in sleep and appetite, and certainly in activities of daily living. People dwell on thoughts of the loved one. And all of that is within the realm of what we'll consider right now normal. 4 possible causes of complicated grief and traumatic bereavement, again, generally speaking, are sudden unexpected loss, violent death, homicide, suicide, or an accident, complicated relationships with the deceased, being a disenfranchised griever, somebody that does not have what we call societal permission to grieve, or with the loss of a child. Complicated circumstances around death, certainly COVID, and not being able to be with the person, with the loved one prior to their death, or being able to have that usual burial and mourning rituals, certainly are possible causes for traumatic bereavement and complicated grief. By the way, I'll have, at the end, I will certainly give you plenty of time to just jump in and ask questions. If something is really important and you want, I can't see all the screens certainly, so feel free to jump in and ask something. Some of the symptoms of complicated grief are prolonged, intense grief. And I kind of laugh when they say at least 6 months, because 6 months is really what I would consider a spit in the ocean, because most people, the normal, in quotes again, course of mourning is at least a year. It gives people the opportunity to go through all the holidays, all the anniversaries, you know, the Mother's Day, the Father's Day, all of those things. So when they say with complicated grief that it's at least 6 months, and there's preoccupation and rumination and intense feelings of loneliness beyond what most people would experience under similar circumstances. A focus and or avoidance of reminders of the loss. So some people will get obsessed with focusing in on different things that are missing or things that are not in their usual daily activities anymore, or they may focus in on the clothing or the surroundings or different mementos. And some people totally avoid anything having to do with the loss. Some people have thoughts and feelings of wanting to join the loved one. That's not uncommon. I want you to, all of the things I've said, consider these as guides and not gods. There is not like one size fits all when it comes to grief. And I'm trying to give you a tremendous amount of information in a very short amount of time and give you the opportunity to ask questions and react to some of the things that I'm saying. Some of the skills and interventions to support people in preparation for post-COVID treatment. This is a time that's going to be very, very challenging to us as art therapists, as creative arts therapists. Our creativity is certainly going to be put to the test with this. But it seems as a country that we are already starting to create new rituals for supporting healing as individuals, as families, and as a country. One of the things that I was surprised and pleasantly surprised to see during the inauguration just recently were the rows and rows of empty chairs. And at first I thought, oh, that's for all the crowds that are not going to be there, who would usually be standing outside of the White House. But actually, my understanding is that the empty chairs were put there, one for each person that died during COVID. So those are some of the rituals that are starting to be incorporated. When we had 9/11, for those of you who lived in New York or who, especially who went into the city, there would be pop-up memorials all over the place. And you would see people putting artwork and memorial tiles on walls and on fences. So we can support families, certainly, and helping them to create their own meaningful graveside rituals or Zoom memorials, photo displays. If you would have told me that we can do grief and loss on Zoom a year ago, I would have said, can't be done, can't be done. I certainly have changed because last summer I I taught my grief and loss art therapy class on Zoom. And I was very, very, very pleasantly surprised in how much people were willing and able to really engage in a really tough topic. Some of the advantages of that were that you can have people from all over the world. And during some of the Zoom memorials that I've attended, people are able to talk in ways that they would not be able to talk if it was a live cemetery and a live memorial service. The idea of being able to have photo ops and photo slideshows of the person and having different people in the family create different images that they want to put onto the screen and interact with relatives that certainly couldn't have come to the memorial had it been in person. Another idea that actually comes from the Japanese is something, and I'm talking now about some of the interventions that you may be interested in trying or offering with some of your clients. There's something called Kinsuji, which in Japanese actually means, kint means gold and suji means repair. So it's the practice of repairing a broken plate. And traditionally, what's done is they take gold, silver, or platinum along with some kind of binder, and they take a broken plate and they put it back together again. And when something breaks, it's changed forever. And Santini, who is someone who is interested in this particularly, I'm going to quote as, it's beautiful to think of this practice as a metaphor for your life, to see the broken, difficult, or painful parts of you as radiating light, gold, and beauty. Kinsuji has to do with the symbolism of healing and resilience. First taken care of and then honored, the broken object accepts its past and paradoxically becomes more robust, more beautiful, and more precious than before it was broken. And I don't think that we as human beings are all that different, that our losses are part of our fiber, are part of who we become, and how we engage with our loss and how we make it a part of ourselves determines our future. I look at human beings as myself as a tapestry. And I remember back when I went to one of the conferences many years ago, and they had a weaving in the general area, a big, big loom, and people would come throughout the conference and add different yarns and threads and feathers and paper and different things and created this beautiful tapestry. And I consider that to be like the people that we are. We create ourselves that way, as opposed to being just a white sheet. So we could be a white sheet hanging, or we could be this very knobby and gnarly and colorful and rich tapestry. And how we handle our losses, I think, contributes to the tapestry that we create of ourselves. Loss, I believe, changes us forever. And it's not about being good or bad. It's about change and how we adapt to that change and how we embrace the change. Leonard Cohen has some music, and one of the quotes is, "There is a crack in everything, and that's how the light gets in." If you're not familiar with that and with Leonard Cohen's music, I recommend that you look it up and listen to it. It gives space for thought. You can use the adaptation for this with as a healing ritual. Maybe your client is not up to using ceramics. Adapt to other found objects, whether it's torn paper and collage. Also certainly it can be used with children with just a simple ceramic pot. And you can even enhance it by planting in the pot afterwards, especially with something like a spider plant, which is relatively easy to propagate. And you can certainly think about taking from the plants of, let's say, a grandmother that died and planting it in the pot with them. But I would underscore that whenever you work with grief and loss, especially with children, that you make sure that you try whatever you do before you do it, because the last thing you want is for it to fall apart. You want to make sure that you've tried it out ahead of time. I was asked to be the art therapist for a group of bereaved children. And before I got there, they had been doing what they would consider art therapy with them, and they ordered water-based clay. And they wanted to make picture frames for the loved ones with the children, which they did. The only problem is they were not using a kiln. And by the time I arrived a few weeks later, and they were showing me how proudly how it had worked out. But as you might imagine, almost all the frames broke. And it's not what you want to, I mean, you can use it certainly as a metaphor, but you don't want to set people up for failure, to have everything fall apart. You want to offer some amount of security. And the materials are our vehicle of communication with our clients. So, and their means of communicating with us. Another possible thing that you might want to consider is some type of a memorial wall. Now, memorial walls we think of as public spaces often, and things like the AIDS quilt. Well, a memorial wall, you can certainly also help your clients to set up in their own homes, maybe a wall of photographs of a loved one, of artwork. A former student of mine, an intern, after her mother died, she did a series of watercolors of her mother with the different family members. So she had one of her mother with a grandchild, one of her mother with herself or with her sister. And you can certainly make that into somewhat of a sanctuary space for the person. They can make it into a sanctuary space. So another thing that if they're not into sewing and you want to do some kind of a memorial blanket, you certainly can nowadays set up something like with Photoshop and set up a quilt. I know there's some online spaces that can do that. So I'm having a tad of interference here electronically. I don't know what's going on. Can you hear me? Yeah, okay, great, thank you. I'm gonna have to shut something off. Okay. So the idea of not sewing, of creating this maybe memorial curtain can be wonderful, and making it hands-on. And even though they're not being physically able to sew it, the idea of also being able to have that memorial quilt. Another thing that people can do is something like shadow boxes. And shadow boxes, recently I saw a woman that took all the costume jewelry from her mother and created an artwork out of the costume jewelry of her mother. Can also be done with military medals. And for the loss of a child, someone might consider making a shadow box of small toys and miniatures and things of that sort. Another possibility is the idea of making pillows or quilts or blankets out of clothing of the person. And one of the people that I was in class with when I went through this program took a all the ties of her father and took the ties and made them into a pillow by weaving the ties that her father had left after he died. It's also important to become an advocate with your clients in terms of making funeral directors understand what they want. Sometimes people are not able to advocate for themselves. So by talking to the funeral directors with them or discussing it ahead of time, what do you think this should look like? What's important for you and your family? And if you're uncomfortable with this, I had a former boss that said, if you're not comfortable with it, get comfortable. You know, force yourself to be comfortable with it, because, you know, it's okay to be uncomfortable. Uncomfortable is teaching us that there's something that we need to learn, and there's room for growth there. So the idea of being willing to interact with funeral directors or see what that person and that family wants to do. Does the family want to be graveside and have somebody else holding a camera? Want to be graveside and filling the dirt in the grave? Nowadays, you have to understand that cemeteries have a lot of additional rules from what they had formerly. So where sometimes families would customarily fill in the grave, maybe they're not going to be allowed to do that. Sometimes the cemetery staff is there, and then afterwards they have to step away while you're there. You have to step away while they fill in the grave. So there are a lot of things that you might want to just open the discussion with your clients so they can ask the questions and have the strength to ask the questions. The idea of memorializing keeps the memory of a loved one alive. My belief is that relationships don't change. I'm sorry, relationships don't end with death, but they change with death. And with COVID, loss often starts with anger, and we can help change that anger into art and into the idea of creative rituals, and help them with advocacy in learning and healing with our clients. The idea of ritual is a very, very important concept when it comes to grieving. Every culture throughout time has had rituals. One of the problems in this country that we've had traditionally is the fact that many of us come from mix and match. So we don't have the traditions that we would have had we been born in our countries of origin. And so what happens is that we are left without rituals. And as therapists, it's important for us to help. And sometimes people want to create some type of place, an altar in their homes. Another student of mine years ago worked in on a children's unit, and when he would lose a child, because in pediatrics it's not unusual to lose a child, to lose a client, what he would do is he would take some small piece of their artwork or some little memento from them, and he would add it to his altar at home as a way of honoring them. And having that is really important. When it comes to grief and loss work, first and foremost practice is good self-care. It's the ultimate is good self-care. And in times of in times of COVID, it's that much more. I was online in one of the workshops recently with two people that are working with clients on inpatient units, either in inpatient or in care facilities. And what they have been working, one of them 365 days without a break since the beginning of COVID. And it is vital to have rituals for yourself, to keep yourself healing and to keep yourself from collapsing under the weight of it. So when it comes to grief and loss, first and foremost is self-care. Get yourself support and fasten your seatbelt. I would like to leave you before I open to questions, because I know I've given you a lot of information, but keep in mind that wisdom and grief comes with experience. So it's really important for you to be gentle with yourself and gentle with the people you support, with your clients, with your patients, both professionally and personally. And I want to thank you, and I really would like to open it to questions, and certainly would give you more information if anybody has any questions. You can just open your mics and put it out there.
Vivien, it's Jillian. Hi. Oh, you're on mute. Hi.
Anybody have any?
Yes.
Or put something in the chat.
Vivien, can you hear me?
I can't hear you. Uh-oh.
Can you hear me?
Am I having trouble with
I can hear you.
Okay.
You can hear me?
I can hear Vivien and Jillian.
Okay, I'm going to turn off the Bluetooth. Okay.
Okay. You can hear me now?
Yes, thank you. Sorry about that.
Okay. All right. So you were saying that it's common for someone who's lost someone to have a desire to, like, be with them, and so how have you dealt with that in the past? How have you turned that into something that can be healing, or with art? Because it's a really heavy
If somebody, in other words, if somebody comes to you and says, I really want to be with my loved one. Well, for certainly, one of the things we have to understand is that we have different areas of expertise, and don't practice outside of your scope of practice. If somebody needs to be in a safe environment, you need to make sure that they get into a safe environment. I think with anything, it's the idea whether this is in the beginning of the loss or whether this is something that continues. There's a big difference with somebody that says, I want to be with my mom, or I want to be, or to have them continue that. And 6 months and a year later, and they're still doing that, and they're still focused on it. And again, do not be afraid when it comes to suicide to ask. And often people will say, well, I'm thinking of, I just don't want to wake up, whatever. And you have to ask the question instead of saying, are you thinking of hurting yourself? And because they'll say, no, I'm not thinking of hurting myself. I'm thinking of killing myself. So you have to ask the questions directly. Do you have a plan? Are you considering suicide? Do you have a plan? Because if somebody has a plan and, not only the thought and the plan, and they have to be in a safe environment. And we aren't therapists, we're not psychiatrists, we're not inpatient units. I hope that helped you out, but don't be afraid to explore things, because if you see something in their art, it's probably real. It's probably existing.
I have a question about
I can't see. Oh, yeah, got it, Deborah.
survivor's guilt. Like, I have this client that says that, oh, she should have died and not her husband. And she just struggles with it a lot. She's not suicidal, but she just has that feeling a lot. And do you have any ideas or directives for that?
Well, I think the idea is to understand that that's not unusual, and to explore maybe where that derives from. It could be something just simple of the fact that, why did he die and why didn't I die? The survivor's guilt. It's not unusual, and just explore it through different directives. And don't be afraid to ask, what do you think? Why do you think? Put it out there, or do art that is less directive and see what comes out in terms of the symbols that are going on for that person. I don't know whether you want to ask anything like more specific to that.
Okay.
Can you?
Well, she needs a little bit of
I
direction.
just lost myself.
She needs very clear directives. She's not going to come with it.
I'm
She
gonna-
want specific.
I'm sorry. Could you repeat that?
She
I
would
saw
need,
your mouth move.
this woman would need very clear directives. She's very concrete and wouldn't come up with it. She would want you to specifically tell her what to do.
Well, rather than maybe focusing on the fact that she wants to be with him, what about the idea of just focusing on, we heal very viscerally from grief and loss. And the metaphor and the idea of working with materials that are tangible, although traditionally, and I hate that word, but traditionally, years and years and years ago, males were more, we would always think more three-dimensionally with men than with women. But I believe that with grief and loss, that three-dimensional work is vital. That people, if all you have to do is look down in Washington, D.C. and all the memorials that we have to war, that we believe that, well, we have more mastery over something when we create three-dimensionally. So I would probably look into more three-dimensional work with her and see where that goes.
Okay, thank you.
I don't know whether,
There's a question in the chat that says, how to help a person who has suicidal tendencies but does not want help.
somebody has suicidal tendencies but doesn't want help, then you have to ask, there's, if you don't want help, is this the kind of thing where the person is, has borderline tendencies? One of my partners used to say years ago, if somebody would say, well, this isn't working, nothing's going to work. And she would say, you're probably right, because if you don't want it to work, it's not going to work. Or, sometimes she wouldn't even say that part. She would just say that maybe you're right. Maybe this isn't the treatment for you. Maybe you need to try something different. And say it genuinely, because first of all, we aren't the solution for everybody. And sometimes if they're borderline, they're more likely to say, oh, no, I really need your treatment with you. I really need your treatment. But also to explore what feels good about being in this space, that this space, sometimes people believe that if they give up the pain of their loss, that they're going to lose the person. And that's very frightening, that if I don't stay in this bereaved state, that I'm dishonoring them, that if I enjoy life again, I'm going to be dishonoring them. So that's something that I would probably explore and see what they're experiencing and what they're feeling. I don't know whether that.
And then
answers.
another comment in the chat is it common for someone who has had a loss to feel a strong sense of loneliness, even after several years of his passing? I wonder if this means they haven't processed their death fully as of yet.
They haven't experienced their what?
They said, I wonder if this means they haven't processed their death fully. Oops, I just moved. As of yet.
Yeah. No, well, it depends on what kind of loss it is, whether it's a husband after 50 years, or whether it's a child after 6 months, or whether it's, when it comes to children, you're probably going to wake up every day with that child. You're not going to, this is not going to be something that's going to evaporate. You're going to wake up one day and it's not going to be part of you. When people talk closure, I don't believe in the whole closure thing when it comes to grief and loss. But that's bigger than a bread box.
Oh, I think it's a father.
What? It's
a father.
Yeah, well, I think one of the things that we need again and again, as I've said before, is the idea of ritual, and having rituals, working with somebody on rituals that can incorporate that with your daily life. So you don't feel like you're abandoning the memory, but you're not flooded with it. And if the person is so inculcated with this loss at this point, maybe it is some type of complicated grieving. Keep in mind, the more complicated the relationship, the more complicated the grieving.
And then Risa, you said you have a question regarding COVID guilt. Where are you, Risa?
Yes.
Okay.
Can you hear me?
Yeah. Oh, Risa, hi.
Hi. So over the break, I attended a bereavement group for myself. And there was an individual in my group who gave his father COVID because he didn't take precautions seriously. And the entire 8 weeks, he just, nothing anybody said, not like he just couldn't let go of the fact that he killed his father. And I'm just thinking how many people out there are going through that guilt right now, and what do you do to help them?
And that's why I said in the beginning that usually 20 to 30% of people that are grieving are at risk for complicated grieving. And out of those 20 to 30, we usually get 10%. With COVID, that's why I said it's the next pandemic, is the traumatic bereavement that we're going to be facing. That and professional burnout, because of all of the, I mean, you're working day in and day out and day in and day out with people that are dying. I wish I could say that there's a magic wand for this guy. I think it's going to be a lot more common, that we're going to see a tremendous amount of this. 8 weeks is a spit in the ocean for any kind of grief. So with that type of situation, it's going to be a long haul. And I think that we're going to have a lot more, tremendous amount, because the young people have been, a lot of them have been kind of cavalier about the whole COVID thing. It's like, well, if I get it, it's not so bad because I'm going to have mild symptoms and I'm not going to interfere with my life for my pleasures. And then all of a sudden, they end up bringing it home to a parent or a grandparent, and the person dies. Because, there have been people in public media that have not taken it seriously, and certainly in private media. And it's unfortunately one of the things that, one of the headstones that I love is where you are now, once was I, where I am now, soon you'll be, prepare for death and follow me. And people don't, when you, the elderly, the older people have been where the younger people are. The younger people have not been where the older people are. So they don't have the depth of experience and knowledge. And unfortunately, in this day and age, that's causing deaths. And there will be tremendous fallout for it. That's why I am saying, fasten your seatbelts and learn how to take care of yourself, because this guy is really not going to be uncommon.
There's another comment, I'm sorry, that says, what are some ways to touch on grief and loss within acute psychiatric setting? There is a percentage of patients who are admitted inpatient to deal with grief and loss of a loved one, and they're asking if you have any specific art approaches that might help.
Yeah, well, I actually did a grief and loss group in South Oaks every week with all kinds of patients. And if somebody was floridly psychotic, I would not have somebody in the grief and loss group. But I think that when you're doing something, you have to, when you're working on an inpatient psychiatric unit, you have to aim for middle ground. You can't do something that's going to be disruptive to unhinge someone. Or you can do where you say, you've done a lot of work already, Elise. You've been here for like 10 or 15 minutes. Maybe you want to, just take some art materials and go in the day room or with an intern or something like that. But you're going to keep your directives more general. You're not going to get into the scenario of, why don't you, let's say it was a COVID support bereavement group, you're not going to go in there and say, well, why don't you draw a picture of your loved one in the hospital with intubation and all this kind of stuff. I would focus again, especially if you're doing a general group, more on, general feelings and memorializing. And the idea even of collage work, where you have a little bit more control. I would not use loose materials if I was working with an inpatient group.
And then also in the chat, I'm seeing someone wanted resources for children dealing with grief and trauma.
I have some resources at the end that I'm going to put up. And there's another book that I don't think I put on the end, but not for children. There was, I think, well, I have some at the end, but if somebody wants to email me afterwards, they can certainly, if they didn't find anything at I have a couple of slides at the end.
Okay, also in the chat, Dina Palma has a question.
Oh, no, not Dina Palma.
Debbie's iPad, and then you have 6 minutes to go.
Hey, Vivien,
Okey-doke.
I'm just curious how you've dealt with, or I'm assuming it's come up, just the loss that's associated with how to even, like the conflict that arises in families when they have to plan for these rituals or services, because there's, like, everybody has a different version of what they should do and what's safe given all the COVID risks. And also what it's been like to just process people's, the loss that's associated with the type of support they thought they should get, like expecting certain family members or friends to show up to services, but they didn't because they didn't feel safe, or not being able to get the touch and affection that you needed. And just like, how has that played out in what you're experiencing?
Well, I think that's a big piece, that people have expectations, and use the word should, and they always say, don't should on yourself. What I try and do is have people see things from someone else's perspective. If you were that person, and rather than focus on what I'm not getting, seeing about, at least in the moment, try and show them the resources that they do have. And then in later treatment, if they start in with resentment, how is that serving you? Resentments are like, if I asked you to hold your hands out and I said, oh, Dina, would you hold this battery acid for me? It's like, it doesn't serve us. And ask somebody, how does that serve you? But it's important to have realistic, that's why I said even intervene with the funeral directors and find out what they can have, what is available. And in terms of touch, it's, I've seen all kinds of virtual hugs and all of that. It's challenging. Now that people are starting to get the vaccine, it's going to be less challenging. I think people will start feeling safer if they and the other people have been vaccinated and wearing masks and outside and all of that. But honestly, it's better safe than sorry. It's unfortunate that Reese's group member had to experience this, but we have to think in terms of that. And sometimes, I mean, the Japanese also have a thing about that, you know, it's true that people do die from a broken heart, and that we have to weigh and measure what's more important.
Vivien, you officially have 5 minutes.
I officially have 5 minutes. I thought I saw a Debbie that had her hand up or something. I don't know. If you want to just unmute yourself.
Me. Hi. I have a client who her husband had dementia, and she couldn't cope with taking care of him during the pandemic. So she put him in a day program, and he wound up getting COVID. And so she had to put him in a nursing home, and he died. And she's got like so much guilt. Of course, you know, she killed him. And it's been about, yeah, he died last March at the beginning of the pandemic, you know, and she's just holding so much anger towards herself, you know.
I wish that as soon as you started,
yeah,
I said, I can finish this.
Yeah,
story.
I know. It's a story that's like, you know, everybody has that story. Right. I know.
And that,
so many of my clients.
Say it again.
I work so many of my clients. I mean, this is the population I work with. And I said to them, if you can, do not put them in a nursing home now. Hold off, do the best you can.
Well, one of the things that happens is typically people have less difficulty in grieving when they've been more involved with the person dying.
Yes.
And I'm an end of life doula, and I do hospice volunteer. And I know that with families that are more involved bedside, there is less challenges in the grieving period. I can also tell you that with COVID, it's turned everything upside down and backwards.
Especially when they're not with them when they die.
Yeah. Yes.
Right.
Yes. I know somebody that tried.
Right. And you can't see the dead body even. So that's even worse.
I worked with somebody that tried to bribe the hospital staff to let her in.
Yeah.
And in certain cultures, whether it's with the Muslim culture and with the Jewish culture where they wash the body, a lot of that is not allowed to be done now.
No.
And that's why I said our next pandemic is the traumatic bereavement. And it's vital for you to set the example of taking care of yourself. And what is the guilt serving? How long is this going to have to go on? And I don't want to be frivolous. You can't say, well, how long is this going to go on? I mean, it's been already 6 months or a year.
No.
Very, very, very short time.
No, I would never. I mean, you're talking to somebody. I lost my only child, was killed when he was 22. So I know about grief personally.
Yeah.
You know, so yeah, I understand how long it can last.
I should put up my last, I'm going to do a share screen here. And these are some resources. Can you see that? That's the Cope Foundation is for bereaved parents.
No, we can't see it.
Can't see it, Vivien.
You can't see it? Uh-oh.
Have a minute.
No.
Okay, let me share screen. Okay, that should be it,
Yep.
right? Okay.
Yep, we got it.
That's the Cope Foundation. You can take a screenshot of these. Feel free to do that. I have my information at the bottom. The hospicefoundation.org is very, very good resource for information. So it's not only hospice stuff, it's bereavement, grief and loss information.
Thank you,
And
Vivien. We appreciate
I'm
your
gonna
presentation today.
put the last one up. I'll put the last one up if you can, if I can.
Are leaving.
You can turn me off.
Yeah, do.
I'm gonna put it up, and if you turn me off, you turn me off. So thank you, and I appreciate everybody coming. And if you have any questions, feel free to email me.
Thanks,
Thank you,
Vivien.
Vivien.